Well, thanks to the next generation sequencing, the cost of genetic testing is decreasing a lot. That means that it's now possible to use all these technologies to improve the diagnosis of many genetic diseases, and that means that the number of patients that we are diagnosing is very large. When we have a diagnosis of genetic disease, we have to bear in mind that this is not only important for the patient, it's also important for the family of the patient. And so now genetic counseling is extremely important in that sense, because we can not only diagnose diseases but also prevent newborns with genetic disorders, which is very important for the future. And of course, nowadays there are a lot of therapies or even devices that can be implanted in the patient depending on the mutation. Another important point is the specific treatments in the field of personalized medicine. And now there is an increasing number of drugs or advanced therapies, including gene therapy and genetic editing and so on. And in that case, the genetic information is extremely important. All this information has to be provided to the family in plain language and in a way that the family can understand the risks and the consequences of genetic testing. Informed consents are extremely important in the field of genetics. Genetics is a complex issue. It's not easy to understand for the families, so we need specialized professionals to translate all the consequences and the risk and the limitations of the genetic test. What is important is to do a meeting with the family, what we call a pre-test meeting, to explain what we are going to do and which are the consequences and the limitations of the genetic testing. And then once the genetic test is performed, it's very important then to meet again with the family for a post-test meeting to explain the results and which are the clinical consequences of the results. We have to bear in mind that it's not only to provide diagnostics of the given disease, but also to inform the family of the clinical consequences of this mutation for the patient, for the whole family. Now with the next generation sequencing already in the clinical practice, we gain a lot of genetic information, and we can even identify mutations in genes that have nothing to do with the clinical phenotype of the patient. That means that this is what we call incidental findings. So it's very important to inform the family that when we do whole exome sequencing or whole genome sequencing, we can identify mutations that have nothing to do with the clinical phenotype of the patient, and therefore the family needs to decide whether they want to get this information. This is what we call the right of not knowing the information. In the genetics departments in large hospitals where we perform whole exome sequencing or whole genome sequencing to identify mutations, we need to apply a multidisciplinary approach, and we need lots of different profiles of professionals, including genetic counselors, laboratory geneticists, clinical geneticists, and a new type of professional that we call bioinformaticians. Bioinformaticians are extremely important because now the amount of data we generate by next generation sequencing is extremely large, and then we need to filter all this data to identify those variants that are really causing the disease. We have to bear in mind that we are all different. We have genetic differences between us, but not all of these genetic variants are causing any disease. So it's very important to distinguish between those variants that are normal and not disease-causing variants from those variants, genetic variants that are really causing the disease. And for this, we need to apply extremely complex bioinformatic pipelines, and those that are not really prepared for this is not possible. So that's the reason why we are incorporating this type of professionals in the hospitals.